I'd like to thank you first for taking the time to watch these videos. I'm Dr. Robert Schwartz. I'm an oculoplastic surgeon as well as a facial cosmetic surgeon. I devote my practice to facial cosmetic surgery. I was trained in Los Angeles at UCLA Medical Center in oculoplastic surgery, and then I also did in Beverly Hills a facial cosmetic surgery training as well. I'm an associate professor at Albert Einstein Medical Center as well as New York Eye and Ear Infirmary. My practice is in New York City on the Upper East Side off Park Avenue. At this point, we've made the decision to look into facelift surgery. So let's evaluate the facelift surgery and your face. When you come in for a consultation, we usually sit down and I like to evaluate your face. I always ask for old photos, not necessarily because I want to make you look that young, but because I'd like to know where your face was 20, 30 years ago. Is there volume loss? Is there descent of tissue? Things like that. Most patients will come in and say they look tired and their neck looks saggy. But with that, there's usually jowling. So the first thing that's pointed out is generally the jowling. And patients will say, I'm starting to look like my bulldog. It's sort of funny to me, but bulldogs are born with that. So the jowling that's around the mouth that comes down below the jawline is important to evaluate. First thing I like to see whether there's movement in the face to lift the jowl up, to elevate the jowl and alleviate that look off of the neckline to make a nice clean neckline. Then I always evaluate the space from how deep the neck is to where the chin is, and to see if there's enough depth over there. Sometimes there's a lot of fat covering the front of the neck, where in front of the muscle, or other times we'll see splitting of the muscle. The platysmal muscle will split, sometimes evenly down the middle, like 2 parentheses, other times it's just right or left side. Now the splitting of the muscle needs to be addressed surgically. A small incision is made underneath the chin and the muscle is generally sewn together to make it tighter. To me, it's very important to keep signs of surgery hidden from the public so that people don't really know what you've done, just that you look better. So the first telltale sign of a facelift surgery is generally the incision around the ear. I like to make the incision completely hidden. We see here in the photo an incision that was made around the ear 6 months prior during the facelift, and it's virtually impossible to find this incision. Why is this the case? Because the incision was closed under no tension. Naturally, any excess skin around the ear is just trimmed nicely as a tailor would, and so right around the ear. And the incision is then also hidden inside of the ear and behind the ear. These are nice hiding points for this incision. Through this incision, I have access to this side part of the face, the back part of the neck over here as well, so that everything can be redraped. I like to make an incision around here and then connect underneath the neck, underneath the skin, so that I can redrape the skin adequately, but right back where it used to be in this proper place. Obviously the muscle underneath is tightened. The muscle underneath is called the SMAS, and this is tightened, and there are different ways to tighten it, whether it be deep plane or just to tighten the muscle in an imbrication or plication manner. That'll be evaluated during the evaluation of the patient. If there's volume loss, this can be replaced during the time of surgery. Frequently, I like to take fat, maybe from your belly or other places that you might want to be so kind to donate it to me. I'll liposuction a little bit of the fat out, spin it in the centrifuge, and then transfer it to a smaller syringe so that we can put it into the face nicely. This will then allow for a more 3-dimensional lift as opposed to just a 2-dimensional lift. It's very important that the corners of the mouth remain in the same position after surgery so nothing looks stretched or pulled. That's very, very important. Everything should look completely natural as it was before surgery, thus it should be after surgery.